Dr. Tom Roselle live right now. 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle live. I am in studio waiting to take your phone calls. It's brisk, but it's beautiful outside. Sorry it's so cold, but, get outside and enjoy it anyway. We're here to take your questions on any subject you have in mind. I've got a couple things I want to discuss with you. Perhaps you've had a problem and you've tried, you've applied, you've come up with the same old things that just don't work quite as well as you want them to do. Well, here's what we're going to do. We're going to give you the opportunity to find out what you can do about those things without drugs and without submitting yourself to the potential of needless surgery. We're here at 105.9 FM and AM 630 WMAL. Love to talk to you. Give me a call, 888-630-9625. That's 888-630-WMAL. Love to talk to you on anything, and we see if we can put a ring to your problems and see if we can fix it and turn things around. I'm going to talk a little bit about things that make you go, how did that happen? You find yourself along the course of your life and stuff shows up. And you have to find out why to fix anything. Or you just put the fire out with something that really doesn't put the fire out. You think it's putting the fire out because you may find the symptoms a little bit more tolerable. And maybe you're able to go a little longer. But then they come back and they bite you like a big old lion that's got angry on its mind and your food. Well, let's talk about your immune system. That thing that's supposed to protect you, that's supposed to step up and get you back all the time. But sometimes the protection's not there. Sometimes we fall apart. So what does that mean? Well, let's talk about the colds and the flus and the headaches and the colitis and the allergy reactions and the cancers and the degenerative diseases and so forth and so on. And let's talk about it from a place of there is a reason that took place. It just didn't happen all of a sudden. It didn't happen by chance. It didn't happen because it was your day. It happened because your time on this planet had a lot of things that took place from a structural, chemical, emotional point of view. Structural meaning that there was injury of some sort. And when we talk about injury, we can talk about traumas like car accidents, or we can talk about injuries like you're chewing gum all day long and you're causing your jaw to be lopsided and causes, believe it or not, a tremendous amount of neurological imbalance. Or a lot of things in between. Maybe you were, you had a blow or two as a kid growing up. Maybe you played sports. Maybe you got hit in the head. Maybe you fell out of a tree. Who knows? Chemical side of the triangle, everything that goes in your body from the outside. All those exogenous things that come in and change your chemistry. Change it from the alkaline base that it should to the acid base that it shouldn't. And then the degenerative conditions and the lack of transport that occurs, and suddenly your body begins to break down. And then the emotional piece. That situation in your brain that just you can't turn off, so you get stressed out and your heart beats too fast, your blood pressure goes up, your muscles tighten up. Here's something that you need to remember about that emotional side of the triangle. The body doesn't know the difference between an actual experience, something that really happens, and something that you think about or you emotionalize. So let's take those concepts. Let's take the structural, chemical, emotional. Let's talk about your problems, but let's talk about how that really works and what it means for you to have any of those things go untreated, unresolved over a period of years. We're here at 888-630-9625. So when you were a child, as a child, think about these things. Did you have, did your mother tell you that she had a problem with being delivered? Were you a C-section? Were you a vacuum delivery? Was there any kind of traumatic birth? Were you breech? How about if you were formula fed, that you were given a bottle from the time you came out of the womb? That is not the natural way that a human being survives. You don't get the immune potential that you would get ordinarily if you breastfed or if you were nursed. Were you vaccinated? I guess that a whole lot of you probably were. Some of you weren't, hopefully. But most of you were. How about ear infections? Did they show up? How about respiratory infections? Were you given a whole bunch of antibiotics, steroids, other types of drugs to try to control the symptoms, to try to get you back to where it's supposed to be? Were you given things that were difficult for you to digest before you were about 6 months of age? Did you have injuries that were never treated? Were you medicated? Were you on birth control pills or antidepressants or anything like that for an extended period of time? These minor things set the stage for major catastrophe over a period of time. So now you're an adult. Years have passed, time's gone by, and you find yourself in a very peculiar place. You find yourself totally dragged out, fatigued. You can't function sometimes. The only reason that you go is because of pure grit. You push yourself. Or you're depressed. You're anxious. You can't shut your brain off. You can't focus. You're slow to heal. Something happens and it's like there forever. Your gut doesn't work. You have digestive disturbances. You bloat. You're constipated. You have diarrhea. You have headaches. Your hormones don't work like they should be working. You're totally unable to manage anything that is of a stress nature in your life. You fall. You crack. All of a sudden you show up and your last blood test showed that you were type 2 diabetic. How about allergies? How about the constant presence of pain in your body? I've been in practice for 35 years, and I see patients with all of these different types of symptoms and many, many, many others. But what we have to remember, what we have to look at, is that there is an underlying cause. There's something that took place. People say, well, I got bit by the Babesia bug, and that's why I have Lyme disease. And I got this because I have that. And I did this, and this is what showed up. Well, let me say this to you before we proceed. There are many people who have been exposed to those same microorganisms. There's people who have been exposed to the AIDS virus. There's people who have been exposed to the herpetic virus. There's been people who have been exposed to other types of microorganisms that, in their particular situation, nothing happens. They don't get sick. There's no positive antigen. There's no positive indicator. So the question you need to be asking is, why is that? How come you get sick and they don't? What's the difference between you and somebody else? Well, there is this whole system within our body that protects us. Actually, 5 primary systems: the nervous system and the terrain of your blood and your lymph, the movement of the electrical field of your spinal fluid, your acupuncture system. And when we deal with those things and we're looking at the immune system generally, we have to understand that the immune system is a system of structures and processes within the body that are there to protect you. They go after these pathogens. They go after the tumors. They destroy them. They beat them up. They eat them up, and so you don't get sick, so you don't show the symptom process. And it's your ability, your innate ability to stay well. But we screw it up along the way. We can divide the immune system up into individual components, unfortunately, like medicine does so often. But the problem is that when we just look at the lymph system or the white blood cells or the respiratory system or the spleen or the stomach or the intestinal tract, the skin as a protective outer shell, we miss the point. The point is that they work as an orchestration together, and there are things that mediate it, that cause them to work properly. So I have a question for you. And my question is this: do bacteria, there's no plural for that word, cause sickness? Is that what really causes the problem? Is your health and your immune system controlled by something other than a serendipitous event? Could it be your immune system that is directed by your genes? What do you think? We get fevers and we get chills and we get diarrhea. Why does that happen? And when you have an infection and you go get an antibiotic, is that the right way to handle it? Well, there's a lot of answers and there's a lot of discussion, and we need to really understand what it really means. In wellness care, what we're looking at is we're looking at the body's ability to protect itself. We're trying to enhance the body. We're not going after the disease. I want to give you a truth about something. There was this guy called Pasteur many moons ago. He actually was in the 1800s. And, you've heard about pasteurization in milk and so forth. Well, he was the guy that invented all that. But he was also known as the father of the germ theory. And what he said is that microorganisms are the things that cause disease, the viruses, the bacterium, and so forth and so on. So if that's true, and the microorganisms cause disease, then all of us should end up getting sick when we're exposed to any bacteria that's of any virulent nature, that we don't have a shot that's going to break us down. That was the basis of why we have vaccinations and why we try to protect ourselves through that sort of intervention. But what we need to understand is that viruses and bacterium and so forth have been around forever. I'm talking about billions of years. They're nothing new to this earth. And our body has been designed to work in tandem to that, to be able to work symbiotically, to be able to protect. We shouldn't get sick. Bacteria needs to be around. It needs to break things up. It needs to allow something called the carbon-nitrogen cycle that decomposes all kinds of things, including you, by the way, when you're no longer alive, to have a balance. But the problem is, and what we're aware of, is that there has to be this coexistence. There has to be a balance. And several studies have been done. There was one that one of my colleagues presented, actually, if you were at the Ageless Health Seminar. Dr. Sushil Sims was talking about a physician, a medical physician. Many of you know his name, Deepak Chopra. He's a doc that was a traditional endocrinologist and then embraced his own country's Ayurvedic medicine. And what they did is they took a group of people. There was a very large study. And they injected the flu virus, the influenza virus. It was isolated, and they implanted it directly into the membranes of these volunteers. What do you think happened? What happened was that only 12% of these people out of this total group actually got the flu. 12%. That means 88% of the people didn't get any symptoms whatsoever. How's that possible? The flu virus, this virulent, nasty bug, was put directly into their body, into the mucous membrane, so it was immediately absorbed, and only 12% of the people got sick. Why is that? Well, you know, even Pasteur, before his death, said, maybe I was wrong. Maybe it's not the microorganism that's the problem, since the microorganisms are around all the time. Maybe it's the terrain. It's you. It's the status of your immune reaction. It's the status of how your body functions. If that's true, then we have to take a really hard look at inoculations and the like to see how they really are totally ineffective in our body. They don't work. If you go to the CDC and look up their websites and you put all the data together and you look at journals like the New England Journal of Medicine and the British journals and so forth, you're going to see that flu vaccines have an effectiveness rate of something around 16 to 42%. That is not a big deal. You have a better shot of changing a few things and staying well without submitting yourself to any of those things. So you have a genetic blueprint, if you will, and it governs everything, but it's influenced by your physical and your chemical and your emotional behavior and insults. Science knows this. It's not something that they're unaware of. We know this because we can manipulate in laboratory. We can manipulate in human beings. We can see that when we suppress certain things happen. When we enhance and support certain things, the body stays well. We're going to talk about that, and I want to take your questions on any aspect of your health and how to apply a fix to it naturally. Give me a call at 888-630-WMAL.
Dr. Tom Roselle Live continues now. 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I am in studio. 888-630-9625. That's 888-630-WMAL. Love to talk to you. Any subject that you have in mind. We're talking a little bit about your immune system and why you actually not only get sick, but develop some very nasty degenerative conditions like cancer and diabetes and heart disease and so forth, and you name it. And we're trying to put a little light on that subject, something that you need to know. And what I really want you to know is that you are in control. Nobody else is. You're the one that is in control. There was something called a Human Genome Project, and it was completed in 2003, and we talked a lot about that at the Ageless Health Seminar. And what it came down to is this, is that your genes are susceptible to its environment. And by altering and manipulating the environment, meaning the things that affect you physically, the things that affect you chemically, and the things that affect you emotionally, you can alter your genes. So an area of research and insight and look at came about. It's called Epigenetics. And it was a very, very interesting project that has just spearheaded and exploded the area of the body's reaction to its environment. Now, all of you who've been listening to me for a long time know that I'm a chiropractor, and you know that I have several other licenses and certifications in nutrition and acupuncture and the like. So what I want to do is I want to touch on my home base, and I want to share some information with you that I think is really interesting, but more so important. And there was a great study that came out, and it was about chiropractic and your immune function. And you're going to be surprised who published this thing. And first I'm going to give you the results. And there's something called a chiropractic adjustment. That's when a chiropractor puts his hands on your spine and manually moves the vertebrae back into position and releases the neurological interference, the irritation to the nervous system that existed. And what they saw is that the patients, there was a very, very large study. I'm going to talk about thousands of people. And the patients who were adjusted, manually adjusted, have their spines and their structural systems manipulated, had an increase of 48% in their CD4 cells. That's a tremendous increase in a very important immune component of your body. This is one of the things that protects you. And then there was the control group, these people that were not adjusted. And they didn't demonstrate this increase in immune function during the study. They actually experienced a 7.96% decrease in CD4 counts over the same period of time. Interesting, isn't it? Now, people who received regular chiropractic adjustments, and I'm quoting this, people who receive regular chiropractic adjustments have immune system capacity that is 200% greater. 200% greater than those who don't, end quote. And that was put out there by Dr. Ron Perro, who's the Chief of Cancer Prevention Research at New York's Preventive Medicine Institute and Professor of Medicine at New York University. For a guy like that to put his head on the chopping blocks, there has to be something that is very credible, predictable, and demonstrable about chiropractic. Now, this study was over 3 years. And it was in excess of 100 individuals. And what they found was this dramatic 200% increase in immune competency within the people who received regular chiropractic care. And 400% greater immune competence than people with cancer and other serious diseases. This is significant. It's mind-blowing. But do you think you hear about that kind of stuff? Do you think it's being incorporated into your wellness packages? These are things that you have to demand. Now, in our practice, because we look at the triad of health, the structural, chemical, emotional pieces, that we look at the systems that the body can start breaking down that cause the symptomatic presentations, it's important for us to put all the pieces together. And we do. When we look at structural, neurological breakdown, we ask the question, why did that happen in the first place? What other environmental insults are going on in the patient's life that have to be changed to get this patient back to health? So whether you have high blood pressure, whether you have high cholesterol, whether you have high or problem with diabetes, whether you have joint space degeneration, an arthritic condition of any kind, there is a reason for it, and there's ways of preventing things as well. When we leave structure secondarily, when we don't pay attention to the nervous system, when we don't look at our dietary patterns, and we realize that we're putting a tremendous amount of junk in our system, and then we wonder why we're getting sick. But Dr. Perro stated, when applied in a clinical framework, I have never seen a group other than chiropractic group to experience a 200% increase over the normal patient. This is why it's so dramatically important. We have never seen such a positive improvement in any group, end quote.
Dr. Tom Roselle Live continues now. 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I'm in studio at 888-630-9625. That's 888-630-WMAL. Love to talk to you. We're broadcasting to you from 105.9 FM and AM 630 WMAL. Would like to remind you that if you want to catch up on any of the programs, if you want to record them for yourselves, go to roselleradio.com. That's ROSELLE radio.com, and it's there for your listening enjoyment. We have archived as many of the programs as we can, and there's links to all kinds of things. You can go in there and see the TV presentation that of the girl that we treated that had such profound allergies that she would go into seizures and she would go into anaphylaxis. So take a tour, check it out. And if you'd like to check us out, you can go to rosellecare.com. That's ROSELLECARE.com. And, check our website out. See what you see what you like. And if you have any questions, you can get a hold of us directly through the website. Send us a note, send us an email. We'll get back to you. And it might take a little longer sometimes if I'm on the road traveling, because I really like to answer them myself. But if you would like to talk to one of my docs, just call us at 703-698-7117, 703-698-7117, and someone will get back to you. So we're talking a little bit about your immune system, and I want you to begin to relate to what we're talking about, this area of epigenetics, the manipulation of your gene code that causes your immune system to increase or decrease, to the conditions that you kind of end up with somewhere along your life, whether it's heart disease or cancer, allergy reactions, or degenerative disease. There's a reason why that takes place, and we said that really there's only a few things that cause the body to break down, and that's injury and biochemistry imbalances and emotional and stress patterns. So check yourself out. Kind of, do a check from the nose to the toes and see what you come up with. Let's talk about antibiotics for a minute. Coming up this time of the year that if you have a virus, unfortunately, most physicians are going to write an antibiotic to handle the virus. Well, here's the key. The antibiotic doesn't work against viruses. Doesn't work. It just makes the problem worse. So what are you going to do when you get a virus? Well, there's a lot of things you can do, but you want to make sure the immune system stays strong. Vitamin C, echinacea, zinc are some of the things that you should be on just to make sure that you have a strong immune system so you don't get this stuff. What do you put in your body that makes it worse? Sugar. Realize that 1 teaspoon of white sugar or the equivalent decreases your white blood cell capacity to work. It doesn't get rid of them. They're just there in the sleep. So they shut it down for about 12% for 8 hours, and if you get a bug that comes in and your immune system isn't working the way it's supposed to, guess what happens? You get sick. So don't use antibiotics unless you know that it's a bacterial infection that is a nasty guy that you can't get rid of anywhere else, because we're setting ourselves up for all these crazy antibiotic-resistant conditions, the MRSAs and so forth. Since 2000, the outbreaks of MRSA are widespread, and you get them out of hospitals half the time, and daycare centers, and locker rooms, and you have to be very, very careful that your immune system stays strong. Not that you take these Sani wipes and you wipe off everything, because guess what? That even increases antibiotic-resistant strains. It's your immune terrain that is the problem here. We have to make sure that our cellular responses are working properly. We have to make sure that our body's immune system is doing exactly what it was meant to do. Anything short of that, you're susceptible. You got a problem. And it's no fun to be sick. Consider how the system works. Consider your white blood cells have to go after this stuff. And if your white blood cells are working properly, they send out these little things called phagocytes, and they eat everything up. We're exposed to nearly 400 different types of bacteria and viruses and things that get into our body that we're not even aware of. And we wonder why some people get sick, and we wonder why some people don't get sick. It's kind of an amazing thing to me that we just don't use our heads, the brain that God gave us, and try to figure out why this happens. Why do some people get sick and why don't others? We talk about constitution. Well, constitution simply means your body's immune reaction and whether or not your body can handle what it needs to handle. Did you understand the concept of not having enough alkalinity in your system? See, when your body is not alkaline, that means a pH above 7, it sets the stage for all kinds of things to take place in your body. It sets the stage for you to get sick, because the higher the acid level, the more bacteria grows, the more virus grows. So what causes you to be more acidic and less alkaline? It's very simple. Sugars, sodas, coffee, black teas, fast food, fried foods, alcohol, gluten, additives, preservatives, pesticides, things of that nature, things that we're constantly being exposed to. So you have to fight. You have to turn it around. We have to make sure that our body has what it takes, or what it needs. We have to have high levels of minerals. We have to have balances of magnesium and calcium and phosphorus and vitamin C. Most of the stuff you can get if you're getting organic vegetables. If you're not getting organic vegetables, then you're going to get a lot of this blocked because of the addition of something called halides, the bromides, that they're using to preserve these things. An American study that was done a while back found that organically grown food contained a much higher average level of minerals than any sort of non-organic, no matter where they were grown. And for example, there was 63% more calcium in an organic vegetable, 73% more iron, and 125% more potassium, and 60% more zinc. Would you think that, knowing that we would start petitioning Monsanto to quit doing GMOs and adding bromides and doing that kind of stuff? But we don't, do we? We just kind of sit there and let life handle us. It's an unfortunate situation. There's impurities in foods. The average child gets about 5 servings of pesticides because of the junk they put in their bodies. 888 million pounds of pesticides are applied to foods each year in the United States. Million pounds, 888 million pounds. And we wonder why we're getting sick. We're wondering why, when we eat a piece of beef or chicken, because of the antibiotics that were given the animal prophylactically, that we're getting sick. Why is that? Why is that happening? Is there a better way? Of course there's a better way, but unfortunately we don't look at the better way. In the 1700s, okay, roll the clock back about 300 years, the average person consumed about 4 pounds of sugar per year. 4 pounds. It actually was kept under lock and key in the house by the lady of the house. And that 4 pounds now, extrapolated 300 years later, and the statistics come out somewhere, 2009 was the last one that they published, more than 50% of all Americans consume 1/2 pound of sugar per day. Do the math. That's over 180 pounds per year. I don't get as much as most people do. So subsequently, we've got something called, we talked about the epidemiological studies, but we also have something called psychoneuroimmunology. A Harvard University study, Harvard, the Ivy League Harvard, the Harvard University study in the 70s discovered receptors on our immune cells for something called neuropeptides. And the neuropeptides are chemicals produced by the brain that have to do with our emotions. Well, here's the deal. Your immune system is sensitive to what we're doing emotionally. So here's the emotional side of the triangle. So when we have problems with depression, when we're feeling suppressed, when we're feeling anxious, when we feel like we're being controlled, or we're trying to control somebody else, or we're angry, there's things that happen, like we decrease our body's white cell count, we decrease the ability of the white cell to work, we decrease our killer T cells that go after cancer cells, and it goes on and on and on. So if we know those things to be true, why isn't it that we're focusing our attention on prevention rather than trying to go after a bug that's only there and setting up housekeeping because our terrain's screwed up? So there are things that we can do that help. I mean, when's the last time you saw a real schmaltzy movie and you cried a little bit and you laughed a little bit and you had a good time? When's the last time you learned how to relax? When did you go out and take Kung Fu or, Tai Chi Guan or Pilates or yoga? I go to the Chinese Martial Arts Institute on a regular basis, several times a week over in Merrifield, because it's what calms me. I do the Kung Fu-based Tai Chi, which is called Tai Chi Guan. And I can relax, and my body lets go, and I walk out of there. Because after the day that I put in most days, at the end of the day, I am physically, emotionally depleted. And I can go home and put my feet up and do nothing, pour myself a glass of wine and say, I'll do it again tomorrow. But I do something that helps me reclaim myself. I go relax. I learn how to breathe. I move my body slowly. And then I get in the gym a couple, 2-3 days a week as well. And those of you who are sitting there and say, well, I don't have the time. Listen, you don't know what my schedule is. If I have the time, you have the time. I just got off an airplane and came to the radio show. I had 45 minutes to get from Dulles Airport to the station to do this because of you. Because I want to educate you. I want to help you. My life is committed to you. And so you have the time. You really do have the time. Even if you do it at your house. You get a tape and you put it on video and you do it that way. You have the time. But remember how your brain works. The body doesn't know the difference between an actual experience and one that you think about. So your brain affects everything else. It affects the bone marrow. It affects the thymus gland, which is the center of the immune system, produces T cells in the body. It affects the beta cells. It produces, all the antiviral, antibacterial things that you need, but we mix it up. So how do you help yourself? How do you maximize your body's immune system? Well, we have to make sure that our intestinal system is working well, that we've got good bacteria in there. We have to make sure that when we get a fever, by the way, you don't take a ton of aspirin and knock the fever down and let this thing become chronic and get in and break systems down. Fevers, unless they become brain-threatening, are your friend. That's how you get rid of stuff. Your body's saying, I got to burn this stuff out. I got to get it out of here. You have to look at your diet. You have to get some exercise. As far as I'm concerned, you need chiropractic care, you need acupuncture, you need those things on a regular basis to support your wellness potential. There are many things that you can do. That's what our office does, by the way. We try to put all the pieces together to help people maximize their immunological response. Whether you choose to exercise and eat properly and get some emotional, mental relaxation, you have to do something. You have to do something that's going to change you. To do nothing, to sit there, to listen to a program like this, to go out and read literature and say, oh, really, that's interesting, or to say that, oh, that's crap. Why isn't everybody else doing it? If that's really true, why aren't the traditional doctors doing what this guy's talking about? Well, let me tell you something. There's big money in medicine. There's big money in farms and nutrition by the conglomerates, the Monsantos of the world. There's huge dollars, and it's not to their benefit to let you know what you can do to help yourself. We can talk about how we control, or how government controls, or how vying organizations control the foods that you eat. There's all kinds of behind-the-scenes manipulation to get a piece of your wallet, to your pocketbook.
Dr. Tom Roselle Live continues now. 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. We're talking about your immune system today and the fact that you have control. Nobody else does. It's all about what's going on inside your body, your head, your chemistry, that makes you either resistant or not resistant and succumb to the nastiness. And I want you to remember that, and that's why we're doing the program today, because we're coming up into that flu season. We're coming up into those viral, nasty bugs that come up and bite you. Well, you don't have to end up with a problem. You can actually step up, stay strong, and not get sick. Let's go to the phones real quick. Nancy, thank you for calling. How can I help you?
Yes, hi. Could you tell me if somebody could be healed without surgery from a basal cell carcinoma?
There's a lot of basal cells are the easiest ones. You have a lot of different things, but the short answer is yes, but you have to have somebody that really knows what they're doing. If you go to the New York State University of Buffalo School of Medicine and Biochemical Sciences website, they talk about basal cells, and they talk about how you handle that just with vegetables, high levels of antioxidants, beta-carotenes, vitamin C, selenium, things like broccoli and carrots and citrus fruits and so forth. Supplementally, vitamins A, C, E, beta-carotene, selenium, and so forth. There's a lot of home remedies that can be used, but you got to keep the junk out of the system. Vitamin D levels have to get really high. Sun is good for you, and it's not the sun that's causing the damage. It's the omega fatty acids that are very low in the body and not protecting the skin. So that takes you to things like fish oils and the flax borage complexes and so forth. If you have enough of that in your body, generally you can avoid this stuff. One of the things that people don't understand is that caffeine drinks, and those particularly containing NutraSweets and hydrogenated oils and so forth, and sugars and saccharides and nitrates and MSGs, they will cause you to be much more susceptible to any kind of skin cancer. So the short answer is yes, but it has to be very, very specific. So if we can help you with a nutritional guideline, we'd be more than happy to do that. But there's a lot of data out there. Once you can get a hold of me on our website, Nancy, at rosellecare.com. I'll be more than happy to send you some data and some links. If we can help you, please let us know, and thank you for calling. We're here every Sunday at 12 noon trying to bring you the most up-to-date information and put you in the directions that you need to walk in, to help yourself, to make a difference. Because the truth of it is that your health is a do-it-yourself program. Those of you who've purchased my book understand that it's a handbook. It's a way of taking your life in a direction that's going to be sustainable for a long period of time. You can always get our book through our website at rosellecare.com. And by the way, the audio version is out, so you can hear my voice all the time. Wouldn't that be a really obnoxious thing? I mean, a good thing to do? We'll see you next week right here at WMAL at 12 noon at 105.9 FM and AM 630 WMAL. This is Dr. Tom Roselle. See you then. Bye.